Hello, everybody. This is Gary. Today is Monday, April 6th, 2020. It is 1:06 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is just a quick check in on my mental health and coronavirus coping. Um, I'm doing okay today. The weather's actually getting better today in Rochester. It's about 50 or 60 degrees outside. It's sunny. Good weather for exercising. I got my bike out. It'll help me cope. In New York State, we have a stay-at-home order for the coronavirus infection, but we're allowed to do certain things outside that are considered essential, like exercise, solitary exercise, like going for a walk or riding my bike on my own, and still keeping up social distancing by staying about 6 feet away from other people. I went to Walgreens Pharmacy the other day to pick up a prescription and buy some supplies. They're actually out of a lot of things. I tried several different stores for certain things like hand sanitizer and toilet paper, and those are the two things that are totally gone. I even went to Walmart.com to try to order them. They're out in Walmart.com as well, not just the stores, but in their warehouses. It's impossible to order anything from Walmart that has anything to do with hand sanitizer, hand soap, or toilet paper. At least that's the way it was yesterday when I ordered some stuff. I finally did order some stuff from somebody else. I ordered two things from Amazon: the toilet paper and face masks. I believe they're cloth and they go over the face. There's three in one pack and they're reusable. They're washable. I didn't feel right buying any surgical or medical masks because I know doctors and nurses and other healthcare professionals need the chance to get to those first before anyone else. But there is a new suggestion out. I guess you could call it a suggestion from the federal government. The CDC is now telling everybody to wear masks when they go outside, not just to protect you from getting sick, but if you're carrying the virus and you don't have any symptoms, it's possible that you'll infect other people without even knowing it. So the face mask prevents you from, well, basically breathing and spitting on other people accidentally. Um, there's a theory going around that coronavirus may be transmissible by air, not just by sneezing or coughing, but just by talking. And that's why they're suggesting everyone wear face masks, especially here in New York State. I'm in Rochester, New York, but in New York City, New York, they're having a lot of problems. I think they've had well over several thousand deaths in New York City and the surrounding area, like New Jersey, Long Island, and places like that. But New York City and New York State still have the most cases in the United States and the most deaths. There are several states in the United States where the governors have not made a stay at home quarantine order for their people who live in their states. Most of the states have. There's only like 4 or 5 states left that haven't put any restrictions on anybody by making them stay home or asking them to stay home. I'm not sure what their reasoning is behind that. I think they're just going to make the problem even worse by not having people shelter in place, as they call it. Um, but we definitely have that order in New York State from the governor Cuomo, and like I said, you're allowed to go out to do essential things. In New York State, that means going to the laundromat, exercising outside, especially it's a nice, beautiful day today. It's very sunny. It's about 50, 60 degrees outside. Um, uh, but my mental health is going pretty well. I'm feeling a little bit paranoid, a little bit nervous, but I feel better as the weather gets better because I really, really hate winter, and I'm glad that spring has finally come. I'm starting to exercise again, walking, riding my bike, um, keeping up with my work schedule. I do consumer surveys online for money, and I've already released a video about that with some of the survey sites if you wanted to check them out for making money. If you do go to a survey site and they ask for your credit card, then it's a scam. They're not going to pay you for doing surveys. They just want your money and they'll try to trick you into buying something. Those websites are scams. Any survey site that claims to be a consumer survey site but wants your credit card or bank information, that's fraud and that's a scam, and you don't want to give them your personal information. Um, but my psychiatrist hasn't been able to see me in person. Uh, I live considerably far away from my psychiatrist's office. It takes me 2 hours by bus to get there and another 2 hours to get back, just because the buses really run really crappy in Rochester and I have to catch connecting buses. So it's more average wait time than it is actually riding on the bus for 2 hours. It just takes 2 hours either way to and from my psychiatrist's office because I'm basically waiting for 45 minutes in the bus station, another 45 minutes at the bus stop. So most of the time is just waiting for the fucking bus. Um, but anyways, my psychiatrist and all the psychiatrists at my clinic are only seeing people over the telephone or talking to people over the telephone as their psychiatric sessions instead of doing it in person. There's a lot of things that have closed down, um, and they told me do not go out to my mental health clinic in person. They will not see me if I do that. If there's an emergency, um, they could always have an emergency counselor talk to me over the phone. There's an answering service for that. Um, but I'm seeing my psychiatrist. I keep saying seeing. I'm talking to my psychiatrist on Thursday. I think at around 11 a.m. this Thursday this week on the 9th. Um, so I'll be checking in with my psychiatrist by telephone. Um, I'm coping pretty well. I have food, money, all the medications that I need, my prescriptions and over the counter medications. Um, Sticking to certain routines like writing poetry at allpoetry.com, um, making videos like this one to help me cope, um, just trying to keep a routine going. That's important. Um, Even if you're alone, it's important to keep a routine of some kind. If you have loved ones that you can talk to over by computer, like on Facebook or FaceTime or Skype, you should do that just to keep in contact with people so you don't feel totally alone. But if you do see a psychiatrist, make sure you keep all your appointments, whether that's by phone, over the internet, or in person. Um, so I'm just kind of chugging along here, feeling a little bit better than over the past few weeks. Um, just doing my best to cope. Um, Not much else to talk about, really. I haven't quit smoking like I said I was going to on April 1st because it was just too much chaos for me to try to quit smoking right now. So I'm still smoking the same as I usually smoke, about a pack a day. I was wearing nicotine patches, but I was smoking while wearing the nicotine patches just as much as I was smoking without the nicotine patches. So that's a waste of time and money. I have nicotine patches, but I want to save them for when I'm more serious about quitting smoking. Smoking while I'm wearing the nicotine patches makes absolutely no fucking sense whatsoever. It's just a waste of the patches and it's a waste of money. And I had to order the patches online from, I think it was like England, because the ones in the United States are too expensive. They're over the counter in the United States. You don't need a prescription for them, but my insurance won't cover them. Uh, Even if I got a prescription for them, because they're over the counter, and my particular insurance doesn't pay for medications that are available over the counter. I'm assuming they're over the counter in England too, because that's where I ordered them from. I also got a box, I think, 2 boxes of nicotine gum, and I'm not using those right now. I will be in the near future as things start to settle down. But I was watching the news over the past few days, and a lot of people are saying the next 2 weeks, especially in New York State, are going to be hard. More people are going to die more frequently. The cases in general are going to go up in number of coronavirus, COVID 19. So the next 2 weeks may be a bit hellish for some people. And I know it's hard to cope. I mean, unless you're a complete psychopath, you do care about what happens to other people. Millions of people in the United States and in the world are losing their jobs, their businesses, their employees. Um, Millions of Americans just in the past 2 to 3 weeks have filed for unemployment insurance. That's a program in the United States that if you get laid off and you weren't fired, you can apply for a limited time set of income called unemployment. Um, and millions of people have applied for it, not just in New York State, but in all 50 states. Um, I think that's one of the reasons some governors don't want to close down their states because they're afraid of hurting their economy. But they're not thinking about the long term. They're putting other people in danger by not having a shelter in place order for people in their states. There's only 7 or 8 states who haven't done that. But so I'm just gonna continue to cope, hang out, do the best I can. Um, Not much else to talk about. Um, I made a video a while ago about gang stalking, and I said how I don't believe it's real. It's a symptom of psychosis. Um, I understand some people can get stalked. If you have an ex lover, an ex spouse, you may get stalked by them. If you're a famous celebrity, you might get stalked by a crazed fan. If you're going through a divorce, maybe your ex hired a private detective to follow you around. These things happen, and I understand that, but those are not the things that I'm talking about. I'm talking about real hardcore paranoia, thinking that everyone in the world is following you when they're not, and you have no logical reason to believe they would, or why you would be so important as to have lots of people follow you. If you feel like you're being stalked by a large group of people, especially if you think it's the government, you need to see a psychiatrist and a therapist and go to your general practitioner, family doctor if you need a referral. But gang stalking is not real. I just wanted to point that out. But that's all for now. Hit the notification bell if you want to receive notifications of new videos that I put out. Even if you're subscribed to my channel, um, you may not get all the new videos coming out as they come out. So just hit that bell at the bottom of the notification button. Um, like, subscribe, comment, share, and I'll talk to you later.